Good afternoon, everybody. Thank you for braving the elements to join us here. We'll order out for snacks and sleeping bags as we need to over the course of the next few hours with the rain. Great to have you here. Thank you for managing your schedule so that you can spend a few minutes with us today. As we do every year at this time, we celebrate the unique role that we have in the stewardship of patients and families who trust us with their health care, who trust us with their health, and we also celebrate what we've accomplished. We talk about some things that are in front of us and how we're responding to those. First of all, it's an interior room, so we should be okay. First of all, we need to take a look at our own vital signs as a family here at Children's Medical Center, as a team, and that's what we're about this afternoon. This has been a great year. Let's talk about some of our accomplishments because we need to focus on what we've been able to accomplish, which helps us understand what we can accomplish. In 2010, we reduced emergency room wait times by 83% in terms of the number of patients who needed to leave without being seen. That puts us right at the top of the pyramid, folks. We're doing a fantastic job relative to our contemporaries and relative to our colleagues across the country who work in children's health care. We also maintained or increased access in our ambulatory care clinics in 28 of 32 of our different specialties. Again, a great record of accomplishment that mean that kids and families can get in to see the doctor when they need to. We opened 2 new My Children's offices, Grapevine and Cedar Hill. They're both beautiful sites. I think I saw Ray in the audience. I know you're as proud of them as we are. We also reduced the bloodstream infection rate across our hospital. We now have units that have gone more than 500 days without a bloodstream infection, and that's fantastic, particularly in our high acuity areas. Cardiovascular, ICU, hem-onc patients, stem cell patients. Now, here's the upside. As proud as we are of 500 plus days, we have some contemporary organizations who've been out there for 5 years without a bloodstream infection. So that's what we're chasing now, folks. That's what we're chasing now. We completed the installation of our Epic electronic health record, and through our pharmacy and supply chain processes, we've saved several $1 million. These are headlines. We could talk for the rest of the afternoon about what we've been able to do, and you know this because you're out there doing it every day in the work units with your contemporaries. These are fantastic results. I'm very, very proud of you. I'm proud for you. This is done in a year when our numbers went up dramatically. In fact, we have a 9% increase in our patient volume over 2009. And if you think about legacy encounters are now almost 91,000 each year as part of these bar charts. That's a 27% increase over 2009. And if you take this back even farther into 2002, 2003, it's been a phenomenal track record of growth. I also want to talk to you about some of the challenges that we're confronting. This is what we want to spend the preponderance of our time on this afternoon. The simple fact of the matter is that for all we've accomplished, life's getting harder. Life's going to get harder here at Children's, as it's getting harder in our personal lives. I get it. When we go to the gas station, when we go to the grocery store, when we go out to eat, we go to the clothing store, we take care of our kids, go on vacation, everything has gone up. There is a sad, simple fact. Everything has gone up. And that makes it harder in terms of how we balance our personal lives and keep everything in perspective, but that's also going to inform how we balance our professional lives and what we do here at Children's Medical Center. We have serious challenges at the state and the federal level that go beyond the state of our economy, and let's spend just a couple minutes talking about that. There are a number of state and federal programs that are being discontinued. At the state level, whether a child is on CHIP, or they're on Medicaid, or they're on children with special health care needs funding. All of those programs on an inpatient and an outpatient basis are being cut in the proposed budget at the state level. What's more, children's UPL, which historically has been part of the state of Texas budget, has been completely eliminated. That's a $75 million, not a $7 million problem, a $75 million problem for Children's Medical Center. Likewise, at the federal level, the president's budget, which he has just submitted to Congress, says that we have a $10 million incremental problem because children's graduate medical education, the money that we get reimbursed to partially offset what it costs us to educate the next generation of pediatricians and pediatric subspecialists, has been eliminated. So when you add those two numbers together, you get an $85 million dent in our revenue base. What does that mean? Well, in just a minute we're going to talk about that, but what we're doing in Medicaid, CHIP, and children with special needs programs is we're moving from cost-based reimbursement, which we have enjoyed historically, to now the government will set a price that they will pay for every procedure, every test, every admission, every diagnosis that we treat in their all patient-related, diagnosis-related groups format. Those who come from the adult world understand that because we've been living in that for several years. But if you can produce what you need to produce in terms of outcomes underneath that number, you're going to continue to make money to reinvest in programs and people. And if you don't, you're going to be faced with some hard decisions of either how to get down underneath that number, or are you going to discontinue programs or services or service to particular patient populations, depending upon diagnosis and the like. 85 million. What does that really look like to us? 85 million is 14% of our controllable expense base. So if we take all the money that we spend, and we subtract out the things that we really don't have an opportunity to control on an annual basis, depreciation, bad debt expense, amortization of our debt, and the like, whatever's left, we've got to take out 14% of that. And we're going to talk about that process in just a minute, because we don't know if this new methodology for how we get paid is going to happen September 1st of this year, next year, or the year after next. But we need to be prepared for that, and that's what we're doing right now as we work our way through the Budget Recovery Initiative. Rest assured, many of us in this room are spending a lot of time in Austin. We are spending time in Washington, D.C., talking with our state legislators, talking with our federal legislators, talking with the executive branch of the government in terms of their philosophy and their understanding of the issues. And what's more, that means that we can convey through a now soon-to-be limited number of legislators, some 6 to 13, if you will, as the process pares itself down over the 147 days that the legislature meets, we'll know more. But what we do know is how we get paid for what we do is going to change. It's going to change dramatically. We've got to get out in front of it. So we have our Budget Recovery Initiative underway. The goal is for us to take out 85 million from our expense base, to go back to that earlier slide. And we need to take that out this year, not because we want to, because we need to. We have to. Because no matter what happens in the House and Senate versions of the state budget at this point, it is an inevitability that whether we must address this head-on now, or 2 years from now, or 4 years from now, this is what we're going to need to do so that we can continue to do what we like to do, what we know how to do, and bluntly, what we love to do. So we have 8 different work groups that are enumerated across the bottom of this page, and we also have categories of opportunity. We have a green category, a yellow category, a burnt orange category, and a red category. Burnt orange because it's Texas. The last session, people clapped. And I said, be careful what you clap for because you don't know what's in this category, so we're going to have to think about that. The point is If we rely strictly on the number of green ideas that we have identified to date, we can come up with about $45, $46 million. That puts us a little bit over halfway. So if we're not able to identify any more green ideas, and my sense is that we are going to be able to identify green ideas because we've not yet tapped into the collective expertise of our organization. We're still very much working through this. So if we can come up with all green ideas, we never have to move into the yellow, orange, or red categories. If we don't, then this will be additive. And we'll take the 46 and do what we need to do in the yellow and do what we need to do in the burnt orange to produce $85 million of savings on an annualized basis. If you are a director in the audience this afternoon, you're already enrolled in many of these projects. If you're not a director, you're going to be invited to be enrolled. You're going to be invited to implement. You're going to be invited to offer feedback. You're going to be offered the opportunity to prototype solutions so that this literally cuts across our entire organization, left to right and top to bottom. Someone in the last session was worried whether management is involved in this process. Let me tell you something, folks. You don't want to be in the conference room that's next door to my office. Management is deeply involved in this process. Is that fair, Doug? I understand. Well, thank you. Thank you for violently agreeing. I appreciate that. So, if we keep thinking about budget recovery and we keep thinking about performance improvement and how we do things, we can be well assured that we're going to be able to address the 4 strategic priorities that we talked about last year, the 4 strategic priorities that I want to spend a couple minutes talking about, and the 4 strategic priorities that your colleagues who are sitting next to you will explain to you in a video in just a few minutes. So, clinical leadership. What does this mean? We want to be the undisputed leader locally, regionally, nationally, and internationally as the hospital in North Texas that takes care of high acuity, high complexity, high resource consumptive illness, whether that's in heart surgery, organ transplants, kids with cancer, kids who need brain surgery, kids who are burdened by trauma, incremental and innovative gastrointestinal diagnosis of disease, and the like. It also means that we will have a depth of people and technology and equipment and space so that we can be responsive to what this means. It means our specialty outreach across the Dallas-Fort Worth Metroplex will continue to expand to improve our referral and consultative processes. And by way of example, our new South Lake Specialty Care Center and Ambulatory Surgery Center is our move into Northeast Tarrant County to help us continue to fulfill this strategic direction. 2, we're going to line up our resources so that we deliver the right care at the right place at the right time with the right resource. That means that we're looking at the linkage between and among our campus here, our campus at Legacy, our soon-to-be campus in South Lake in June, our 10 ambulatory care sites, both primary as well as specialty care that we have stationed across the Metroplex. And it also means that we're going to use disease management so that we can take care of diagnoses like asthma, diabetes, keep the kids out of the hospital as much as possible so that they can enjoy their quality of life and not have to come into the emergency room and not have to come into the hospital. 3, research and education. It is what differentiates us. Research and education, by virtue of the next generation of physicians, pediatricians, pediatric subspecialists, science in terms of moving back the horizon and reducing the distance between what we know and what we do, whether that's in a clinical setting or a basic science setting. We've talked about this before. We want to be a children's hospital that's adding to the font of knowledge, not taking from the font of knowledge. We want to be the creators, the disseminators of this new knowledge, and this is how we're going to do it with the creation of our Pediatric Research Institute. We're in the active phase of bringing on board an executive director for that endeavor. We're leasing 2 floors of the new research tower at UT Southwestern, and in the next few days you'll see a press release related to the recruitment of the leader of that particular endeavor. Al Gilman, Nobel laureate, PhD in pharmacology, former dean of UT Southwestern, and now the head of the CPRIT initiative, the cancer research funds that are being distributed across the state. He and I frequent the same car wash roughly at the same time. As he said to me, when you get this person, it will, and you will, Chris, it will be a shot heard around the world. So stay tuned. Whether you read the newspaper, or you read the newspaper on your tablet, or you read the newspaper wherever you read the newspaper. If you don't read the newspaper, learn how to read the newspaper. No, I'm just kidding. You're going to see an announcement about this in the next few days. 4, all of this hangs on the notion of superior quality. Safer, better outcomes, better experience, all those things that you do every day, melding, merging the passion and the skill and the ability that you bring to what you do in taking care of each child, each family, and in taking care of those who are at the bedside. If we focus on these things, our quality, our service standards will inform our performance measurement, they will inform our reward and recognition systems, and we will integrate this as we have continued to do across, up and down and diagonally throughout our organization so that we have an expressed and an implied commitment to each other and the care of children that place the most sacred trust in us. In the midst of all this, our mission has been, remains, and will remain to make life better for children. I thank you all for what you do in that regard each and every day. I know that our future is secure because of the way we fulfill this mission. What I'd like to do now is introduce a video where some of your colleagues and the people seated next to you, as I look out in the audience, will tell you about how we take these strategic priorities and have turned them into realities, are turning them into realities, and will turn them into realities. Thanks.